I was just introducing our workshop. I wanted to let you know that we'll go through the workshop tonight. It will be on healthcare help, doctors and specialists. It's how to partner with these providers and how to really, get the best out of that healthcare that we all need for our kids and that we pay for. And of course, how to make that relationship a good one. Um, my name is Tina Purcells. I'm a parent consultant with Utah Family Voices. We are a family-to-family health information center, and we're a project of the Utah Parent Center. I'm sure a lot of you have heard of the Utah Parent Center, and that might be how you got here tonight. So thank you for coming. And we are going to have the workshop, and then we are going to have a special guest. Her name is Mindy Tuller. She is a fierce advocate for people for children with special health care needs. And she is the manager of the Medical Home Portal. The Medical Home Portal is a website that is specifically created for families and doctors of kids with special health care needs, children with special health care needs. And it encompasses everything from what to do after you've received a diagnosis to transition into adulthood. You can take a look at that. You'll see more later with Mindy. And if you have ever heard of the Medical Home Portal, please put just in the chat. I'm just interested in hearing how many of us have actually seen the portal, and we'll learn more a little bit later with Mindy. So I wanted to tell you a little bit about myself and why I'm here tonight. I have two beautiful children, Adam and Araya, and they are 20 and 21 years old. Adam is the older, and Adam is my preemie. He was born early at just 28 out of the 40 weeks that you're supposed to go to when you're pregnant. Adam started out rough. We took a helicopter ride across the valley on a really rainy morning. I went into labor with him and was taken up to the University of Utah. After that, he would spend the next 367 days of his life in the NICU up at between the university and Primary Children's Hospital. Adam came home a year and 2 days after he was born, along with a ventilator, a feeding pump, nurses, and lots of follow-up care with specialists and doctors. We were lucky to find a primary care physician that was willing to dive into this journey with us, and I'm sure glad he did. Adam has a long list of diagnoses that started early. Hydrocephalus with a VP shunt, cortical vision and hearing impairment, complete oral aversion, no motility of his esophagus, tracheostomy, premature lungs, which is now called chronic lung disease as he's gotten older, cerebral palsy in his legs. He uses a feeding tube to eat. He has epilepsy, nonverbal speech impairment, and, drum roll please, autism. I hope you're okay with me smiling when I say drum roll please. That was just the last one that we just didn't even know we were going to get when he was 4 years old. Most of the others came, of course, along with his premature birth. He also would endure 30 surgeries before he was 5 years old. And that is why I'm here today to help you in your journey of working with doctors and specialists. And then we have Araya, beautiful Araya. She is Adam's younger sister and his partner in crime. And she was lucky enough not to have all of these diagnoses. Still, watching her grow up right alongside him, almost the same age, she has had to advocate for certain things at the doctor herself. And so it's always good to remember that as we go along in this journey, if we can, with our kids that have special health care needs or don't, we want to teach them to advocate for themselves alongside of us advocating for them. So let's just dive into this and talk about working together. Learning to work together with your child's healthcare providers will help you become an active partner in care decisions and will benefit your child's health care. Good communication is much more than listening to what the doctor has to say. It also means learning as much as you can about your child's condition. Asking the doctor to explain anything you don't understand, speaking up for your child's doctor is an and speaking up for your child's doctor is an expert in his field, but you are the expert on your own child. You can help the doctor get to know you and your child and develop the right treatment plan. Finding a primary care doctor. Many of us who have kids with special health care needs have a hard time finding, the primary care doctor that we prefer for them. And sometimes it's easy. It was kind of just a lucky easy for us in the beginning when we needed one for Adam when he was young. But sometimes it's not so easy. Families want a healthcare provider who will be a partner in caring for their child. Well, sometimes a healthcare provider enters a family's life in a different way, or like in the emergency room through that way somehow. Most of the time, parents are able to choose their primary care doctor. And the primary care doctor can help oversee all of their care, including well care, referrals to specialists, and coordination of care and services, including community-based services, even helping with things, community needs like an IEP or a healthcare plan at school. This central provider approach to care is referred to as medical home. To find a primary care doctor in a medical home, the family really needs to, look at lots of ways to find the right one. Ask other families who they recommend. Contact support groups or disability organizations for recommendations. Ask the clinic about the doctor's experience with your child's specific needs and their comfort level. That's important. I mean, we don't want somebody who's uncomfortable, and if they don't feel like they could meet the needs, then we want to move on and find someone else. Ask potential doctors about their views on the team approach and shared roles. That's important because we want a team approach with someone who has complicated needs. Even if you don't have complicated needs, I think a team approach is probably pretty good. Seek out doctors that you feel your child will feel comfortable with. That's important. Sorry, I've got things moving all over my screen here and I have to move them back around. There we go. So what can the doctor help me with? I don't know how many of you have felt like, I don't know how many of you have felt like maybe, you couldn't ask questions or you don't have a comfort level. Just know that these are things that they are there to do for you, to help with your child's care. So answering questions, don't be afraid to ask questions. Shared decision making, that means, hey, Dr. So-and-so, um, can you help me decide whether we should do um, this treatment with herbal something or other, have that shared decision making together and work together on this healthcare piece. It's important. Communicating with other providers and coordinating care. That's a big one, because if you don't have the other providers working with your child, um, communicating back to that primary care physician and everybody being on the same page of what's going on, um, you could create situations that don't need to happen, or miss something. That's kind of it's kind of what can happen when you don't have them connecting with each other. I know just with myself, I have a neurologist and a cardiologist and an orthopedic surgeon, and they all, you know, communicate with my primary care physician. So she has a record of what's going on with me. And she'll sometimes call me and say, hey, I've heard you went to the cardiologist. Same with our kids. We want that piece to be linked. Providing resources and tracking how well they worked. We at our doctor's clinic had a care coordinator there that would give me resources, and it was kind of cute, because every time she gave me resources, the first one would be the Utah Parent Center, and I appreciated that a whole lot actually. But providing special resources that might be helpful for certain things that are going on for a child with special health care needs is a great service to have in a pediatric office or young adult office. Um, and then knowing how well they work. So asking when you came back, hey, how did that voc rehab resource I gave you work? Or how did that, whatever it might be, how did that work? I want to know, because I want to make sure I'm giving a good resource to everyone. That's a good doctor. Building bridges among families, health, education, and social services. Um, it's really good. I like it when I see that a doctor knows to tell a family that they should be doing this or that in their IEP or their healthcare plan at school, or if they know that maybe a child might qualify for SSI or Medicaid, and it would really help the family. There are a lot of doctors out there that will call us at Utah Family Voices at the Utah Parent Center, and it just amazes me, and I thank them every time that they call on behalf of their patient and family to find out about these resources. It's amazing. Again, good doctor. Developing comprehensive plans of care that address your child's needs. That's, of course, really important, and especially with our more complicated kids. A comprehensive plan of care, again, would include those other specialists and look at treatments and how one might affect the other. Maybe you want to look at in the comprehensive care plan, times of treatment, and maybe one has to be done later than the other. We're again working together with other providers as well on the care plan. Developing plans for emergencies, that's great if your provider knows about it, and how to plan for an emergency. I think and always, again, as we're going through these things, you can ask, hey, I heard, you might know how to help me plan for an emergency. So don't be afraid to ask, because these are things that a good medical home should and can do. Monitoring and updating and follow-up care. I love it when I get texts from the doctors that say it's time for your follow-up appointment, or it's time to update your file, or it's time for this year's whatever test that needs to be done. I love it, and that should happen with every doctor. Respecting your values and culture, absolutely. And a lot of times, I think sometimes we might start off with a doctor that they're a doctor. We made an appointment and we're there, and then we may not get the best feeling, or we may not just sometimes human to human, um, things don't feel right. And so it's okay to say, I'm not sure that I'm being respected here, and just find a different doctor if that's the case. We always want to make sure that how we feel and the importance of our history and family and all of that are respected for sure. And then promoting health and quality of life for your child and family. That can mean a lot of things, mainly promoting health and quality of life. And I like how it says for your child and family, because a medical home recognizes the family. They recognize the circle of support around that child and how they're affected and what their needs might be. So by working together, you and your child's doctor can help your child stay healthy, safe, and happy as possible. So you know the history of this little man here, Adam. And when he was little, there used to be a wishing well in the very front entry of Primary Children's Hospital. And I walked in and out of those doors at least 4 times a day. And I always made sure I had some change and made a wish. And what I decided was the only thing I could wish for, the only thing I could maybe control, because I needed control at that time, was that he were happy. And if I could just wish for him to be happy, maybe everything else would come along. And what I found out is we needed a lot of doctors to keep the healthy and safe piece in check. But he sure is happy. Look at that face. So what is a medical home? I wonder if anybody knows. If you do, just jot it down in the chat, and I'm going to check the chat when we get through here. The American Academy of Family Physicians defines a medical home as one that is based on joint principles of patient-centered medical home, shared principles of primary care, and the 5 key functions of advanced primary care. The goal is improving the quality, effectiveness, and efficiency of care while still responding to each patient's unique needs and preferences. The 5 key functions of a medical home are access and continuity of care, planned care and population health, care management, patient and caregiver engagement, and comprehensiveness and coordination. No matter what your primary or specialty practice, you'll want to see that they are adopting the 5 key functions of a medical home, which can benefit the care of your child and the ability to engage, for you to engage as a team member. It's medical home is an idea and something that is taught to doctors, and some providers and specialists may adapt medical home and some may not. But if they are calling themselves a medical home, if they're familiar with that term, that they know about engaging you as a member in your child's health care. Working with your child's doctor. After all, parents live with their child and care for them every single day. A parent knows all of the ins and outs of a child's daily care and special needs. And for example, a healthcare provider can't know that a medication prescribed to be taken 3 times a day requires 20 minutes to be given each time. And unless a parent or caregiver tells them, they're going to prescribe that medication. Um, it's up to the parent to ask if there's another type of medication that might work better or a different route for it to be given. And I think, we have to remember that we need to be engaged. We will be invited, but we need to take that step to be engaged as well. Before the visit, read up on your child's condition. In spite of what many people believe, healthcare providers are becoming used to more health savvy parents. And many of them are even relieved when they don't have to spend too much time explaining the basic facts about a child's health condition. Use the library or internet to learn everything you can about that condition or disability. Remember, not all websites are going to give you accurate information. Look for government sites or those affiliated with educational or a well-known medical institution. Write down questions. That's a big one. Do it for your kid's appointment and yours and everybody else's. You go to appointments, because it's just write down your questions. I walk out of my doctor's appointments all the time, and I forgot to ask him this. I forgot to ask him that, and then it's too late. You got to wait till the next appointment or call the doctor's office and wait on hold and all of that to get someone to help answer it. Keep a journal of your child's responses to new treatments, any signs or symptoms. If you're given, if you make a plan and decide on a treatment and go home, I mean, if it's something simple, no, but it's good to keep a journal on certain types of things so that you can bring that back to the doctor, again, engaging and saying, here's what happened after day 2, or nothing really big happened, just giving back that input. Keeping organized your medical records, dates, places of visits to specialists, emergency room visits, hospitalizations, surgeries. I know a lot of this is going virtual. It's going online. It's going into the systems that, you can click into and look at through your provider. Like, I don't know what they're called right now, but anyway, they're those records that the doctors and the healthcare providers keep and you can get into. And it's important to remember to keep some medical records, that you can take with you to a doctor's appointment, to keep some information that you can show them and or have with you, at least, to give them. You're going to get a lot of questions sometimes, and we will talk more about a way that you can do that when Mindy Tuller comes on later, and we'll show you a little bit about record keeping there as well. Keep the contact information of all the healthcare providers organized and easy to find. Remember that. And remember that when we go on the portal in a few. Choose your appointment times carefully. If your child's appointment is a first-time visit to a healthcare provider, or if you believe you need a little longer of a visit to discuss a problem, ask the scheduler to schedule a little extra time for the appointment. Think over what time of day works best for your child. Sometimes doctors will have a little extra time in the morning or a little extra time at the last appointment also. Remember that. Most kids have trouble waiting in an exam room when they're tired or hungry, and you can avoid this by scheduling the appointment right after lunch or mid-morning if possible. If your kid is cranky and it's a time of the day that they're going to be cranky and this is the first time they're going to meet this new doctor, consider that and try to figure out, how to get them in the best mood you can before you take them. Prepare any materials to show them. Be ready to discuss your child's conditioning, drawing on your expert knowledge of them. And when I say drawing on your expert knowledge, there's a saying about, it's most heard about kids with autism. And it's once you've met one kid with autism, you've met one kid with autism. And I say that about cerebral palsy or any other medical condition out there because they're all individual. And that creates a need for, a need for that doctor to understand them individually, and you and that child are going to be the best ones to show them, a little bit more in detail about his patient or her patient. Um, for later visits, such as medication monitoring, one mom says using a chart or a spreadsheet compiled of that daily journal. And when you have a complicated child, it can be difficult to show the healthcare provider what you're seeing, such as out of control behavior, appetite changes, or reactions to medications. Prepare your child for the visit by telling them what to expect. Take comfort items along with if needed. And yeah, sometimes it's hard for kids to, I know my son, because he's had so much medical experience, we'll say, that he does get quite a bit of anxiety going into the doctor's office. So we always try to prepare every time. My daughter and I they used to have the same pediatrician, and we used to both talk to him and tell him, okay, they're not going to give you a shot today, or they're just going to look at you. It's just your checkup, and really get them comfortable going in. And then ask for help. If an unfamiliar medical office creates anxiety for your child and it can trigger a meltdown, ask another adult to accompany you to the visit. I just made an appointment for my son today to go up for dental in August. And I let my husband know that he will be needing to take the day off to be with me there because that will trigger a meltdown for my child. And then don't be afraid in the office if you need help as well. If you need more help than that one person that you brought with you, then don't be afraid to ask office staff. They can help. During the visit, first of all, acknowledge this picture because this kid is so cute at the doctor's office. He is one of my friend's kids. An office visit could be as short as 10 to 20 minutes. Make the best of this time. I know that insurance not insurance, healthcare companies are really cracking down on how much time a doctor can have in the office with you. And it's really sad because sometimes you do need more time. So plan ahead, keep an open mind, share the information, everything about your child, listen carefully, take notes if needed. If it's a big appointment, if it's something that is really complicated, have somebody else take notes for you while you're talking. I've actually gone and done that for friends before at appointments because it's just too much to take the notes and talk and understand everything. So they were just my scribe. They were there to make sure I could, look back on it later. Ask questions, make a plan, and ask to meet the office staff. It's always nice to know who else is in your doctor's office. And there's nurses, there's care coordinators, there's billing people, and it's nice to meet face to face if you can, and get to know those people. And then when you call on the phone, you can say, hey, can I speak to Cindy, the care coordinator, please? Or can I speak to Heather, his nurse? And then make a plan. Work with your child's healthcare provider to make a plan. Don't be afraid to ask for another visit to discuss things if you need to do so. That's the thing. If you're coming to the doctor, there is a reason you're coming. And so if it doesn't get fully addressed in an appointment, ask, I know this appointment isn't going to quite take care of what we need. So I think, can we have a follow-up within the next week or whatever? Don't be afraid to ask. If you need more information about a plan of treatment or a test that they're talking about, ask the provider to give you resources to learn more about it. And then always, never be afraid to wait and think about whatever treatment is being recommended if you're not quite sure. And then just take the time to research and talk with other providers if you need to. After the visit, remember, you know your child best. You're part of the team. And so I think of when I tell people you're part of the team, I think of, oddly enough, I think of, when they used to come to the bedside in the hospital, and they call it rounds. And there would be like a doctor and a nurse practitioner and maybe the pharmacist and maybe a physical therapist, and me. And I was part of that team. And I just think of this little huddle of people that that care about this one patient, and they're doing the best they can to create a treatment plan and a plan of care and happiness. Contact the doctor if once you get home and you're like, I just don't understand. I'm drawing a blank. I need more help getting whatever it is. Call them. That's what they're there for. And I don't think they really mind, hopefully. I think it's very important to them as well that what the treatment plan is or whatever it is you talked about. And again, change doctors if you're not satisfied. I don't recommend jumping doctor to doctor, but try to find one that works for you and your family. Advocating for your child. Now we're going to level up to advocating now. Don't be afraid to speak up. No question is stupid. It's okay to question a suggestion by a doctor. You might know something they don't. Okay. And speaking up can get easier with practice, and find ways to practice. Okay. Practice speaking up on behalf of your child. Many parents feel uncomfortable talking with doctors or afraid of asking stupid questions, or seeming rude by questioning something the doctor has suggested. Most parents find that speaking up gets easier with practice. Okay. I have helped out with some programs at the U to talk to resident doctors that are learning about people with special health care needs. And I'll never forget, years and years ago, I had a resident doctor ask me, what if I don't know something? So my job was to be that knowledgeable parent talking to this resident about how they should work with us families that have kids with special needs. And this one person was just really worried that she wasn't going to know and have the right answer for somebody. And I said, that is being human, and that's okay. I'd rather have you tell me you don't know, but you're willing to learn, or you're willing to help me research, than to tell me, I don't know, to not tell me or not work with me. So remember that we all have questions about, none of us can know everything. And that includes our doctors. And that's important. It makes them very human. Oh, let me go back just quickly. So the next slides have some examples of good ways to voice your concerns. Just some little quickie examples. Sorry, guys, I'm drinking a lot of water tonight. So finding what works. So here's the example. Your child's doctor writes a prescription for chewable antibiotics, but your child has a hard time with chewables. Well, what do? Tell the doctor that your child has had problems with chewables in the past and ask if there are alternatives. You may also ask the doctor to make a note in his file that chewables are not a good option. Sometimes you'll have to tell him like 3 or 4 times, and that's okay. Just be patient and say, remember last time I told you, and that's okay too. But let him know, it's just something that's not going to work for him, and that's okay. And that's just a small way of advocating for your child. You've received a letter from your health insurance denying payment for services you know should be covered. First of all, take a deep breath before you make this phone call. And then call the insurance company, explain to them, I have a bill and a denial right in front of me. Can you help me figure this out? By appealing to the person on the other end, can you help me figure out exactly where this problem is? Rather than getting angry, you have a better chance at getting to the root of the problem. I promise you, I have done so many of these phone calls over the years. Remember, my son's 21. And appealing to someone is so much better than calling angry, because that person on the phone, first of all, is not responsible in any way for the bill that's wrong. And secondly, they're going to help you. They're going to partner with you and help you figure it out. Okay. Ask your doctor's office staff to help too. They may even call the insurance company for you. Make sure they have let you know what was said if they do that for you. But sometimes it's a code or something that the doctors can figure out. And then one more, your child has just been scheduled to have blood drawn for the second time in 1 week. Ooh, ouch. The doctor may not know or remember all the details at first, but you can help remind him or her. And you can say, do you know, he already has some tests done this week. Can we get any of that information from previous tests? I'll give you another example. My son needed blood work done, and it's really difficult for him to have blood work done. And he was going into the dentist anyway and had to be put under. So I said, hey, as long as you're putting him under, can I call his primary care doctor and have him order labs to be done at the same time? And I'll be darned, he sure could. And so don't be afraid to ask a question. Sometimes they go, oh, Tina, you're brilliant. Oh, let's do that. Okay, so remember. And then, I had one more. Oh, and this is important. The doctor has quickly written a prescription, not thinking, about how the medicine might be really costly that he's writing the prescription for. Let them know that it's really expensive and ask if there's a generic brand that could be prescribed instead. Or ask if there's samples. What I usually do is I will ask, do you know if that's covered by my insurance? Is there a way we can figure it out? Just to make sure, because it's just the worst to get to the pharmacy and find out, oh, that is $195 for that little tube of some cream you might need or some, medication. So don't be afraid to ask for help there. The pharmacists can also sometimes help, and don't be afraid to ask them too. They're providers. They're part of our team. And so always be nice to that pharmacist, because they might be able to help you with cost as well. And then be a team member. Okay, being active, in your child's healthcare team is the best way to help your child, I promise. And especially if they're medically complex. You want to keep good records, and communicating well will make it easier for you and your team. So having, keep your records and then let them know about those records. Don't be afraid to speak up when you feel that you need to. That's very important. Sometimes I can't go back to the millions of times I could probably tell you when I did speak up and the doctor went, oh, let's check that. So speak up. It's okay. And then last but not least, enjoy that beautiful child of yours, because life can be really hard with appointments and medical issues. but just remember to stop and just absorb it all and smell the roses, guys, because there's so much to be said for having our kids. There's some resources here, and I would like to ask my partner here if she'd like to grab that and put it into the chat. Oh, I don't know if we're going to be able to do that. Oh, sorry, guys. I don't think we're going to be able to put those in the chat. If you would like either one of these, just put it in the chat and we will make sure that we get these to you. And so now I would love to invite you to just take a peek at this wonderful resource for families. Like I said, families and their doctors and providers. Can't say enough about this resource. You'll have to check it out. And Mindy is going to be our guide tonight. Hi, Mindy. I see that you're in
San Francisco.
San Francisco. It's beautiful.
Yeah. Isn't it wonderful that I can be in San Francisco in my own living room at the same time? It's great.
Very nice. So I am going to go ahead and have you share your screen.
All right.
Let's see how I do that. Hang on here.
Okay.
I'm going to stop share. AJ, can you help her share her screen?
Okay. Looks like I'm still not enabled.
Her name, go to participants, go to her. More.
Hang on, we're having some technical issues. We'll get you there.
No worries.
Oh, make. Did you see that?
Let's see. Let me try it. Oh, hooray. Yes.
Okay.
It is working. So now the question is, are people seeing medical home portal? Go back to the home page. Right. Tina, give me a thumbs up if you're seeing the medical home portal. Yes. Okay, great.
Yes.
All right. Well, hey, good evening, everyone. And thank you. Oh, somebody else is in San Francisco. That's great. It's a great city. Thank you for joining us tonight. And I am really excited to talk with you about the medical home portal. And so Tina, just guide me. If there's something that I don't spotlight in particular, let me know. So the medical home portal is Utah based, and it's been around for a while now. And it was started by my boss, who he is a pediatrician, a general pediatrician, who really noticed that there was a lot that was needed to better care for children and youth with special healthcare needs. And so this has been a work in progress for a long time now. And as Tina mentioned, it's got a lot of information on there for both clinicians and their teams, and also for families. So I'm going to do a pretty quick tour. And then, as Tina mentioned, we'd really hope that you will take advantage of it and look through it yourself and use the search field here and really explore it and see how it can be helpful to you. So the medical home portal is not only for resources in Utah and information for people in Utah, it's actually got a lot of really great general information, but also information specifically for a number of partnering states. So we may be a little bit more robust for Utah since that's where we're based, but we also partner with a number of states in the Mountain West, and then Rhode Island, who we like to think has a very, very intelligent state on the East Coast for their decision to partner with us. So I've gone ahead and set Utah as my home state. And if you take a look up here, you can see in the URL that now it says ut.medicalhomeportal.org. And that's important because what it does is it makes sure that our services directory has information that's relevant for people in Utah. So I do want to talk with you just for a couple of minutes. This is our home page. And if you scroll down here, you can see that we got a cute guy there. And we have some information about what, in fact, the medical home portal is, including the kinds of information that we have on here and how often we keep it updated and how, and our mission and our goals. We also have some information about partnering with the portal. So this would be kind of more for, organizations and regions. We usually partner with someone at the Title V level, and that's usually in a Department of Health. And then, as Tina was mentioning also, we talk about what medical home is. That's the name of our website, and it's an important concept. And we really do encourage you to try and find a primary care provider for your child or children that really does things in the medical home model. If you scroll down a little bit farther, you'll have another way of kind of navigating through all of the areas of the portal. But I'll kind of show you the main navigation up at the top. And we have some testimonials from folks, and then just kind of the usual things at the footer, including information on how to contact us and information on providing feedback, which we really, really like. All right, so I'm going back up to the top, and I'm going to kind of start on the left and work my way across. So we're going to start here with the diagnoses and conditions section. Now, this is written specifically for, and I better show you how to set Utah. So if we were, in fact, to start at kind of the main page, you would see the whole US in our little map here. You would note that up here, there's no UT or anything else in the front. And you would see that this box says nationwide, which means really general information in here. And then you do the drop down. And I encourage you to choose Utah and to actually set it as your home site. All right, back to diagnoses and conditions. So these are really written for primary care clinicians. The point of medical home is to have a home for the issues that your child and your family are going to experience over the course of that child's life and that experience of that condition or that diagnosis. And so these are written to help primary care clinicians and their teams do their very best in understanding the diagnosis, treating and managing it, and helping connect you and your family to the resources that you're going to need, whether they are very medical or if they're different. Tina mentioned community-based organizations. So they help you, put you in connection to those kinds of things as well. So we have currently 55 different specific conditions or diagnoses that we have in-depth clinical information on. Now, I said that these are written for primary care clinicians, but they are not limited to that group of people in who can access them and read them. And we encourage you, if we have specific information about your child's condition, it is written by experts and it is kept up to date. It is peer reviewed. And we feel very strongly about the excellent information that we provide in these. So I want to show you one pretty quickly. So I'll go ahead and choose Down syndrome. And we have a lot of information that is covered in these. And so I'll go through very quickly. And I hope that doesn't cause any problems for you. But we start with a description, and we even talk a little bit about what other names this condition might be known as, how to code those, the prevalence. We'll talk about genetics, if they play a role, if there are practice guidelines out there, and in this case there are, we will link to those and make sure they stay up to date. And then, hey, we even talk about the role of the medical home specifically for this diagnosis. And then you'll kind of see over here on the left, particularly as I move down the page, that the area on the left is highlighted to show you what is coming up and what's on the screen. One of the things that we think is kind of interesting about these diagnosis modules, as we call them, is that we will put in what we call pearls and alerts. So these are things that maybe aren't out there in the general information about the condition, in this case, Down syndrome, but the experts on this condition, the specialists, they see these and they know about these kind of important nuggets of information. So I personally think this is really interesting. Sleep apnea is common in individuals with Down syndrome. AAI may not require treatment. Well, I don't know what AAI is, but I bet if I was a parent of a Down syndrome child, I would know. And this might be very interesting or very important. And also, wheezing may not be asthma. So that's also very interesting and important, probably for that primary care clinician to know about. So again, I'm going to go really fast now. We have sections on screening, testing, learning what else is going on, what has happened in prior exams, what the family is known to have. And then this is kind of the big section here, the treatment and management section. And we kind of break it down by system. Sometimes these are body systems, or there'll be another kind of system. And as you can see, I'll scroll down here on the left, Down syndrome has quite a few systems involved. And so we try and make sure that there's information on all of those as is appropriate. And then one of the special things that the Medical Home Portal does is it will link you directly to the kinds of specialists who might be important for the treatment and management of the condition in that child. And so if I were to click on this link, and I won't, this would take me to that Utah services directory, and it would show that there are 4 providers in there who are pediatric gastroenterologists or organizations that do that. And so we like to make sure that that information is integrated right in there to help whomever is looking at this page with understanding the kinds of specialty collaborations or other kinds of collaborators. So I see in the chat that someone has a child with a syndrome called APERT, which is not listed, and you guess it might be too rare. Well, that is really interesting, and thank you for bringing that up, Corrine. So the way that we have information on all of these 55 or more diagnoses or conditions is a little bit about who we can find to author those and commit to keeping those up to date. So it may be that we don't know an expert well enough in that particular syndrome to have been able to bother them enough to write something like that. But I'll take this opportunity to go back really quick to that list, and I'll show you.
That makes sense.
I beg your pardon?
Yeah, I said that makes.
Yeah, our specialists are not paid. So they do it out of the love for, learning and spreading this information. But we do have a lot of very rare conditions that are listed on here. And again, that might be because we were just fortunate enough to find someone who had a willingness to write that for us. The Medical Home Portal is kind of a little bit of a different website than many, where you want more and more and more people to get funneled into it. Well, we're kind of the inverse, because we recognize that the population that actually meets the definition of a child or youth with special healthcare needs in some of these is going to be very small. It's going to be a very small number of people who actually have that particular rare or uncommon condition. And we have this little diagnosis prevalence calculator, which is kind of cool. So if I were to say that an average practice size is maybe, let's say 2,000, I'm going to change that right here. What you'll be able to see is that, let's look at Down syndrome. That Down syndrome, which is the most common chromosomal syndrome, we would expect 1 in about 884 patients to show up in a practice of that size. let's keep going down the list because you can see it gets much more rare. The numbers change as we go down. And again, sorry if I'm scrolling too fast and that's making you dizzy. So we have several conditions on here: homocystinuria, 1 in 3,000 patients. That's going to be very rare. So it may be that a physician will never see one of these kids in their lifetime. But what happens if that child and their family move into the neighborhood and get an appointment on the books with Dr. Johnson? Then Dr. Johnson, she needs to be ready, doesn't she? And so that's kind of the purpose for this website. So it's not about how rare or not it is. If you know an expert in Apert syndrome, let us know. Let us know. All right, let me get back to showing you the medical home portal. So that's kind of what goes on in this diagnoses and conditions section. And these are pretty in-depth. They're kind of, yeah, they kind of suck you into all the little details. But again, if we have information on there that's beneficial to you, we encourage you to look at it. I'm going to hop over here. This is another section that is really specific, again, for professionals on that care team. But again, we know that it benefits families to go and look at it. The information here is not typically as long or in depth. So we have information about what the patient-centered medical home is, what we've been talking about, and information to help that kind of a clinic with coding and billing and understanding, all those principles that Tina was telling you about in care coordination and medical home. And then we actually have a pretty beefy section here about more common issues that might go across various conditions and diagnoses. And so this might be very interesting to some of you, and certainly quite approachable quickly from the point of view of a clinician. So we do have information that's maybe not quite as common, but others that really a lot of children with special healthcare needs are going to experience, for instance, sleep issues. So we have a nice section with a number of pages, number of sets of information about sleep issues. So behavioral techniques to improve sleep, that might be something that would be interesting for you. We have information on drooling. We have information on toe walking. We have information on puberty and procedural anxiety. If a child is, very unwilling, like Adam, as I totally get, or it's just really hard to do a procedure. So this might be helpful. All right, now I want to show you the biggest section that we have. And the newborn section I'm skipping over, but this is really for when there's a positive screen for a brand new baby and what the clinician should do if they get a positive screen for any of the, I think, 39 newborn disorders that are screened for in most states and in Utah. All right, so this is our biggest section, and we could not have the information in this section if it wasn't for Utah Family Voices and the Utah Parent Center, and very specifically Tina. So a big shout out to Tina about this section. And it's a lot, so I don't want to overwhelm you right now, but I do want to show you a few of the topics that I think are super helpful. So let's talk about education in schools. This is so important, right? When your child is ready to enter the educational system, it's really important to understand those things like IEPs, like eligibility, and so many other terms, and the process that you need to be aware of and to really understand to get the best out of it for your child. So special education supports and services. This is where we cover 504 plans and IEPs and what the difference is, which is pretty important. Let's see, we've got a comment. Oh, okay, Heather. Take care. Wonderful. Don't hesitate to use that feedback or that contact page if you have questions. All right.
Absolutely. Thank you so much.
Bye-bye. So this section and this page in particular really tries to go in a little bit more deeply to help understand the laws around what, you know, the school system, the educational system needs to do, and that whole process, which is really important. We also have information, for instance, on guardianship, which is a pretty important thing at the right time. So it's over here in our legal issues section. And so we explain what guardianship is and evaluating the need for it and the role of the court or state and contingency planning. And at the bottom of most of our pages, we do put additional resources. So often these are to websites that are outside of the medical home portal that we have vetted and checked. And we feel like the information is very helpful and we don't need to produce that ourselves. We'll just send you to another site that has great information. Sometimes they are something you can download. And that's what this one is, for instance, from the Disability Law Center in Utah, which is a great organization. And then the last thing I want to show you in the family section, again, our biggest section, is that we have this area here called Diagnoses and Conditions, FAQs. And most of those conditions that are in our Diagnoses and Conditions section written for clinicians, we have information that's written specifically for families in here. So in a frequently asked questions and answers style. And so just to kind of continue the theme with Down syndrome, I will choose Down syndrome and just show you. So we have kind of some basic questions and answers. What is Down syndrome? How do you get it? What are the symptoms? How is it diagnosed? Expected outcome? Will anyone else in my family get it? What is the treatment? And how will my family's life be changed? And so we've got this kind of information that might help families at the beginning of this journey ease into it a little bit. And then again, at the bottom, we have more external resources that we think are helpful and really good. And as you can see, there's the Utah Parent Center.
I just wanted to give a shout out to the portal and let all the families that are here tonight know that these diagnoses and conditions, these FAQs the portal has partnered with families and parents on every detail of how this website is written. And specifically these FAQs, we have sought out parents who have children and have experience with these diagnoses and work together with those parents to make these pages understandable, parent friendly, and really coming from a parent and professional perspective. And so I just wanted to say this is one of the most important things about the portal in my perspective anyway.
Well, as Tina mentioned before, and we can't underscore this enough, you know your child better than anyone else. You are the expert on your child. And, you know, the rest of the folks on the care team, they are there to help your child and your family. So we feel very, very strongly that's what this is all about. It's not about the doctor. It's not about, you know, the clinic. It's not about the expert. So, oh, Patty, we know that oftentimes, you know, resources that can be so helpful, knowledge that can be so helpful, it may be out there somewhere, but it's not obvious and it's really hard. Yeah, it's really hard. So yeah, hopefully there'll be some things that can be helpful to your son. And I do want to mention really briefly that we are working hard as a state overall on a transition project right now to really help get some tools in the hands of families and providers, whether they're with a big organization like Intermountain or the university or with a smaller clinic, so that we can have an approach that benefits all kids as they start to get older and need to find healthcare in the adult world. And so I just want you to know that that Utah is taking this seriously. It's been a huge need for a long time, but some really exciting things are happening now. So I saw in the chat that your son is getting older, and I do think that there might be some really great things out there happening. And you know, you can always get in touch with Tina or myself if we can help you more specifically. All right, so I did want to show you really quickly that at the bottom of these pages, again, we've got all these resources that are going to external pages, but also we have services. So just like in that diagnosis module for Down syndrome, this is in the FAQ for parents, and we are showing you that in Utah, remember we knew that Down syndrome, kids with Down syndrome are gonna probably need to see a lot of specialists over their life. And so you can see that we've got a way for you to find who those are here in Utah pretty easily. So why don't we take a look? Maybe we'll look in endocrinology, pediatric endocrinology. I'm going to click on this, and then I'm going to look in the chat really quick. But I'll just show you before I do. This now took us to that Utah Services Directory area. And this is where we're going to be able to find those specialists right here in Utah. So, okay, that's Patty saying great things, you bet. All right, so pediatric endocrinology. So I don't need to search too much more because I know from the previous page that there are only 4 pediatric endocrinologists in Utah. So they're all listed right here for me. I don't need to narrow it down any further. And it looks like actually one of them is probably a little bit different kind of a provider because they're back east. But if I look on here, I can see that the University of Utah Department of Pediatrics is listed. Again, University of Utah, Pediatric Diabetes and Endocrinology in Riverton. Then the Transgender Health Program, which is, you know, maybe a little different focus than for our child with Down syndrome, is listed here. And then here is the Pediatric Endocrinologist Locator, which would help also find other clinicians, you know, throughout the US probably. So, oh, and that's pretty cool. They actually list some camps as well. So find a pediatric endocrinologist, and you can even find some camps. So I wanted to show you a little bit more about the Utah Services Directory. So you can search, and you can search up here, and a lot of different search results will come up, including service providers, or you can search in here by a key term. You can look at our categories to kind of narrow it down. You can do that with a key term or without. Let's just put one in here. There. And then you can actually narrow that down if you want to say, for instance, Salt Lake City. And then you can use these 3 fields, and we've got a smaller number of providers. There would have been probably quite a bit more than this. And you can see where they're located on the map, which may be helpful to you. And then you can also look at them listed down to the left. So what you're seeing here is other kinds of services they also provide, but the one that we're looking at, autism programs, is going to be highlighted. I'm sure that some of these will be, you'll know some of these already. So I could show you so much more. I don't want to take more time than I'm supposed to, but I do want to let you know that there are additional features that we would love to show you if you're interested. And you can always get in touch with us again through the, oh, sorry, I got a kid coming home and a dog that's excited. Through the contact us here. This has got my email address listed right here. And then through the feedback form, and you can just enter that, and we check this very regularly. And Tina, I know that you mentioned wanting to cover something specifically about record keeping. Is there anything that I can cover specifically about that?
Oh, yes. Thank you. That would be the care notebook page.
You bet. Okay, so going back to the For Parents and Families. So it's buried just a little bit, and let me show you the fastest way to get to that in particular. I will also do a little disclaimer that we are right now wrapping up a project to improve this particular page and this particular tool. So it's going to look a little bit different in maybe a week. But Tina, I would love for you to talk if you want, and I can scroll a little bit and show. Would you like me to download the Care Notebook and show?
Sure, that'd be
Okay.
great.
Okay.
So let me start by talking about the history of the Care Notebook. Across the country, several different, am I muted? Oh,
I can hear you.
sorry. Across the country, several different organizations had developed these kind of record keeping books. And we kind of gathered all of them and took the best of the parts we liked best out of all of them and put together the collaborative care notebook. And that's what this is here. This is the old design. Again, Mindy said we're going to be working, or we are working on the new design, and we're going to be rolling that out soon. So check, I would say within the next week or two. I'm going to say 2. And and it's really neat. Now you can have the very most complicated child in the whole world and probably have every page you need in this book, or you can have a child with hopefully just 1 or 2 or maybe just one thing, and you might only need to download one of the pages or a few of the pages that have to do with their actual medical care. What's really neat about this, and what I like about it, is when you have a child with special health care needs, sometimes you have to have somebody else care for them. And this setting up this notebook, having it put together, and having all of the information that would allow someone else to care for your child, including their likes and dislikes, including emergency contacts, including doctors. Let's see, here we are in the table of contents. There's a whole section about myself, and that would be, their information, their health, family information page, a calendar if needed, and any kind of notes. My health care is all about, that special health care need and what's necessary. There's doctor's appointment pages, there's diet tracking forms, there's seizure tracking forms, there's medication lists. It's really great. My contacts, that would be all the people that support that child and family, including healthcare providers, teachers, family, those type of things. And then my plan gives a great way for you to, like I said, you could use all those pages, or you could use some of those pages to put into detail what their routines are, what they like to do, what they don't like to do, how do they cope? Is there a good coping thing that somebody else could benefit from knowing if you weren't there? Their mobility, how they sleep, all of that stuff. And then of course my coverage, and that's a nice section where you can just document insurance stuff, bills, expense logs, things like that you might need. Thanks, Mindy.
You bet.
So,
sorry.
So yeah, it can be quite, years ago, we used to actually print them out, and it's quite a big book. But what we do now is we have it available on the medical home portal, and parents can actually click on a page, and just so you notice, they are available in Spanish as well. But you can click on a page, download it, and fill it out and print it, or fill it out and just write in it. That's what I did. And I'll let you know that even though I was a person who had helped create this wonderful tool, there came a time when my husband said, "Tina, Merry Christmas. Open this envelope." And it said 2 tickets to New York City. We had never left our son. He's, like I said, he's really complicated. He's really hard. I didn't know what to do. And the first thing, I think I had more of a shocked look on my face on Christmas morning than I did happy for a moment, because all of a sudden it just flooded over me of, no, people aren't going to know how to take care of Adam. What are we going to do? We're going to get on a plane and fly to New York. Are we crazy? And so I did put together my very own care notebook for Adam, which I know sounds sad, but that's what we do as parents, right? We put things off sometimes. And it was fabulous. There was everything that my parents and the caregivers that came in to help needed to know in order to make sure he was cared for.
And I will say that as part of the update for this page, we are going to talk a little bit more about some of the ways to do record keeping without printing pages for those folks who prefer to do things a little bit more digitally. And we will also have a care notebook and pages of the care notebook that are fillable PDFs. So it's a little bit of a hybrid, right? It's not an app, but it is something that you could have completely on your laptop or even your smartphone. So that's what's coming. And I think I'm going to double down, Tina. I'm going to say a week and a half. A week and a half, it'll be there.
Okay, sounds good.
Okay.
Well, good.
All right. Well, I think that kind of covered everything that I wanted to talk about tonight, although again, there's lots more. But is there anything else that I can cover or talk about or answer a question on?
The only other thing I'd like, and just in case there are people who have clients or family that need to use a different language, I just want to make sure that you know that we are powered by Google Translate, and you can just click up into there and pick a language, which is beautiful. To be able to, have that in your own language if you need it. So,
That's amazing. I'm French.
oh,
So
awesome.
I thought you did it on purpose.
Oh,
Oh.
I'm so intuitive. Yeah.
So I'm the one with the airport child.
Gotcha.
Anyway, so yeah. And that one is very rare syndrome, like one out of 100,000.
Oh my goodness, that's a tough road. That's a tough road. Yeah.
It is.
But anyway, so this is very useful. Thank you very much. Thank you.
Very welcome.
Absolutely. Absolutely.
So, well, thank you so much, Mindy. This has been such a good tour through the portal. Like I said, I can't talk enough about how much it's useful. I use it all the time to find, resources for parents. I give it to parents as much as possible so that I can help them to get out there and look for those resources and just get through and read. You'll be surprised at some of the cool stuff you'll find in the parents and families section.
I see some asking for tips to talk with a specialist. So we have this section here. And let me go down a little bit. Here's the partnering of healthcare providers. And I know that we talk about, here's some of these things that Tina was talking with you about, preparing for the visit, asking for help during the visit. However, in this section up here, just above it, assistance in choosing providers. So if you have a subspecialist that you're trying to figure out, who's going to be best, this might be helpful. Examples of specific types of questions and questions to ask before. So a lot of these cross over with any kind of provider, but these are honed in a little bit for a specialist. So perhaps that would be useful. Would you like me to put this particular URL in the chat?
Thanks so much. I can find it.
Okay.
Probably. I appreciate that though.
Great.
But maybe somebody else would like the URL.
Okay, I'll throw it in there. Why not?
And Lisa, are you looking for specific tips on talking with specialists?
No, not specifically. I have a kiddo who has not had a lot of encounters with the medical world who now needs to, I'm sorry, he's putting his head in his hand. Now needs to get a specialist for a chronic healthcare condition that he's just recently popped up with that put him in the hospital. So I made him listen to this whole thing, even though he is the one kid who didn't have special needs.
You know you want to listen to me, right? Now what? Now what's he doing?
Now he's hiding under a blanket.
Okay, that's what
But you can't see him. But you know him, Tina, and you know that he's a great guy.
Yep, that's right. And you have to advocate for yourself. If you would like me to talk with your kiddo about advocating, I'd be happy to do that on a private consult one day.
Oh, that's kind. He's only going to be in town for a few days. You know, he lives far away.
Yeah.
Well, the one thing that I will say is the other morning for a monthly meeting that we do, I had a very prestigious speaker who was going to be joining us. And I got a text long before the meeting was going to start. And it was this individual, this very prestigious provider who had mixed up the Zoom time. And he was already on the Zoom, but no one else was there. And he had my cell phone number and he was texting me, did I get the wrong time? And I was like, oh no, did I screw up? And no, I hadn't screwed up. He had screwed up. And the bottom line is providers are people. They are human. And if we can just feel confident about talking to them like they're human, it'll break down a lot of those barriers. And we can just be ourselves and just say the questions that we have, you know?
Okay. And so thanks, Mindy. You are fabulous. I so appreciate you being here tonight and guiding us. Wanted to just let everybody know that the easy way to support the Utah Parent Center and Utah Family Voices is if you shop online, you can use any one of these shop engines and it will help us out. You can just choose Utah Parent Center as the charity of choice. But you can give us a call anytime. We've got several consultants, including a Spanish-speaking consultant that can, just consult with you on the phone. We are honestly here for whatever you need. We are a parent-to-parent model family information center. And so we are all parents of kids who have some type of condition, special health care need. And so we've navigated a lot of the resources and we're always coming up with, the latest and greatest of what's in Utah. And sometimes you call me and tell me about what's the latest and greatest in Utah. I learn a lot from my families that I consult with as well. But like I said, always give us a call. We're just here to talk with you, help you find the resources you need. And even if you just need someone to talk to, I'm going to be that person. So I can't thank everybody enough. I think we're just right on time tonight. So thanks, Mindy. We did well. And thanks, everybody, and have a good evening. I'm going to stop sharing now.
Thanks, everyone.
Thanks, everyone.